There's a couple of questions in there from UHL. Again, do we know, I'm not sure if we can answer this, it's quite specific. Will the eating area in the outpatients corridor be reopened for staff? I know that's more before the pandemic, staff used to enjoy to take a break.
Yes,
was any plans to reopen?
I spoke to Linda Fahey, I think, on that last week. Linda wrote to me to ask for approval to reopen it, and I gave her approval to do so. So it should open soon. If it's not open at the moment, they're probably just doing a deep clean of it, but it is planned to open.
The next question from UHL is on accommodation for the healthcare record staff in UHL.
Sorry, the copy area is open. Sorry, I just see it come up on the screen.
That's coming in from Eileen. Thanks very much for that point there, Eileen. Just the next point in relation to UHL again is healthcare records. And is there any plan to improve accommodation for healthcare record staff?
There is, yeah, and this has gone on for many years for them, and they've worked in very difficult environments. So the coup, Noreen Spillan's been dealing with that for over a year as a chief financial officer, and they have looked at a site off-site. They mapped out the cost. The cost is quite significant. It runs into millions of euro. We've been to Dublin on it through the board, and they had to change the plan somewhat just to bring the cost in line of more value for money. But there is a plan to move to off-site records, and it's in Raheen Industrial Estate again. You'll have way better accommodation, but I think it's to do, I'm not an engineer, but it's to do with loading and charts and safety of staff. But what we'll do is I'll ask the coup to give an update on Team Talk in the coming week or so you know exactly what's happening.
Okay.
Yeah.
Okay, the next question is there any plan to reinstate our staff awards?
It's like they're reading my mind.
Yes.
Yeah, it's fantastic.
Yeah.
Yeah, well, that's a good question. And of course, I was very slow to reinstate them. If you recall, our last staff awards was in February 2020, and I think we dodged a bullet because COVID hit us in March. But the staff safely got through it, and we weren't expecting, of course, a pandemic. So I have spoke to the people that assist me with the awards, and they were anxious to me to do them in the coming months. I would suggest that we do them next February, that we just wait a little bit longer. I was going to do virtual awards at one point, but there's a lot of work in it, and staff were somewhat overwhelmed and tired. So we might look at that in the year end, just to do a virtual acknowledgement of staff and awards, and you'll all nominate when we get a moment, and we do an actual awards night then, probably next February. I think we'd be safe enough then.
That's good to hear, Colin. We have 5 minutes left on the webinar, folks. So if anyone has any further questions, you might get them in as quickly as you can, please. I'm just going back to the pre-submitted questions. One of them is on the My HSE self-service, which is this new app that's being rolled out around the country. When will this app have accurate details for all staff? Because at the moment, some of the staff details are incorrect. I think there's some issues around annual leave balances and reporting structures.
So that's NISRIP, I'd say, Lorraine.
Yeah.
Yeah. Do you want to talk?
Yeah, I'm happy to take that. Yeah, NISRIP. Yeah, so NISRIP is our new self-service deployment of our payroll and all of your personnel details concerning, say, your annual leave and also your travel and subs. So yes, you're quite right. There is incorrect balances on the system at present, but we have a team deployed that are going to be working on actually, going through a validation exercise with all of the directorates in terms of ensuring that everybody's annual leave records are correct. So we will be communicating with staff and asking them to fill in what we call the HR 108 forms to ensure that their carryover, if there is carryover of annual leave, is correct. So from the 1st of April, we'll be looking at a clean slate in relation to everybody's annual leave balances. Yes.
Okay, thanks, Lorraine.
Okay. Yeah.
I think that answers that one. Thank you. And there's another question in relation to coming out of the pandemic, and this is something that there's been a discussion about nationally as well, and what would be the appropriate way to remember people who we've lost during the pandemic. Is there a plan to have a memorial service or to remember people who we've lost in any way?
Absolutely. We looked at that when I'll pass to Suzanne in a moment because she's a novel project underway. But when we were building 6B, as you know, there's a garden there beside it that we were actually going to make a remembrance area out of it, and put in a significant acknowledgement there. And equally, the other sites need to think about where they could do some little piece of architecture. And that was my initial thoughts on it, that we wouldn't name people, but it would be a place to stop and reflect and just remember. And also remember the staff who have worked and got through the pandemic, because they went through significant stress, and I imagine continue to do so. Some of the pressures they were under and what they saw and met in their career, probably life-changing. So we are very aware of that. But in the meantime, then, some new novel ideas came forward, and Suzanne, you might want to speak to the Reimagine programme.
Yeah, so just I suppose it was one of the exec walkabouts, Niall Maintenance said we should look at the pathways, and at the same time we met the Help the Ireland Need, Sarah McCormack. And out of that conversation, we applied for a grant for a design phase for a walkway around the hospital. So like it's a healthy walkway for staff and patients at lunchtime, etc. And with that, it's going to be dotted some very high level architectural pieces or gardens, or we don't know what it's going to be yet. We've just shortlisted the architect, and we're going to bring together a steering group of interested parties, all sectors, so nursing, porters, doctors, whoever wants to, in terms of if you have an interest, email me, and we put together a steering group very similar to what we did with the Health and Wellbeing Centre, and we will absolutely make sure there's a remembrance garden there for our staff, and for the staff who work so hard in COVID-19. So we want everyone's input into that, and then and I hopefully have a nice
and that's UHL. But of course, to add to it, we have our other sites who redeployed and took on work, significant work under pressure and night duty and everything. So there's a lovely garden in Ennis at the front. The staff look after it well. Croom have a nice facility. Nina has lovely facility in some memorial areas. So I'd be asking you all to look at what would be a significant, what would you like to see aside from the Reimagine programme, but what would you like to see as a piece that would acknowledge your staff? And I work with estates on that. So we have two kind of projects running at once, and equally then at St. John's and maternity, you will all need to have a think about that, because your staff will all define it for you, and we'll fund it. Yeah.
Okay, thanks, Colette, and thanks, Suzanne. I think that brings us to the end of the questions. I don't see any last minute questions having come in there. And just to remind everybody that a recording of this webinar will go out to all staff. If you want to watch it again or share it with any of your colleagues, we'll be sending it out in the coming days. And unless anybody has anything final to say to the staff, I think we can.
Just, I suppose, thank you to all the staff. I know it may sound trite, but it's really important that you do understand how very proud we are of all of you. And we also acknowledge how people are, recovering from a pandemic, as are we, and that we're going to move forward now into the bread and butter of our normal life, and just be proud professionals for all you've done for the public. Thank you very much.
That's great, Claire. Thanks again, everybody, for joining us, and thanks for all your questions. And we'll do this again soon. Thank you very much.
Thank you.